Hello, welcome to the Doc Dave Show. Today I'm so pleased that following the request, we've received lots of emails following the previous episode which we talked about heart attack, ischemic heart disease or coronary artery disease. Many people are asking what is heart failure. So we thought maybe we should explore this area in more detail. Because coronary artery disease, as we talked in the other session, is #1 killer of in the whole world, basically. And it is worth talking about the risk factors, knowing what it is, and so we can change what needs to be changed, what we call modifiable risk factors. So today in the studio, to help me break down the heart failure concept, what it is for everybody to be aware or to know, is Dr. Raibhan Yadav. Dr. Yadav is a well-known interventional cardiologist. He's a director also at Townsville Hospital. He's got so much vast experience in cardiology, pretty much. And we appreciate that you've come to the show, Dr. Yadav. Welcome.
Thank you, David. It's a pleasure to be on your show.
Right, coronary artery disease it still remains a headache for the whole world, pretty much, in terms of the mortality it causes. And yet we can help out by just getting awareness, putting knowledge out there, educating people, and working on the risk factors. We might do something in terms of modifiable disease risk factors, but we can work on the genetics, which is also part of the risk factors here. Now, many people want to know what is heart failure. Well, why is my heart failing? What is it? What is heart failure?
So a lot of people use heart failure interchangeably with a heart attack, and that's not the case. You could get a heart attack which causes heart failure, but they're two different things. Yes. So heart failure is usually a poor pump of the heart. So the heart finds it difficult to pump blood around the body, or it finds it difficult to relax and fill. So there are two types of heart failure. One is where the heart is weak and cannot pump blood forward. And the second type is where the heart cannot relax enough and cannot fill properly.
Cannot fill properly. So we were talking about the left side of the heart or the right side of the heart?
Both sides.
Both sides, yeah. So we know from the basic anatomy, I mean, the heart has got, what, 4 chambers?
That's right.
4 chambers. And we've got pumps connected to the heart. We're doing this for the sake of our viewers. Some of we didn't medical terms. We're trying to avoid that.
Yes.
So we've got the heart here. We've got 4 chambers, and we've got pumps. One pump going back to the right, and another pump coming out of the left side. And the left side is going to the body, and the right side is going back to the heart.
So all the blue impure blood comes to the right side of the heart.
Right. That
pumps it into the lungs, which purifies it. And the red blood is pumped by the left side of the heart to the rest of the body.
That's right. Right. So when you're talking about pump failure, what is run out here? What is failed? Well,
so just the heart muscle has become weak. So the pump itself is not pumping as hard as it should. Or it cannot relax enough.
You cannot relax enough. So we're talking about the left side, which pumps the blood.
That's correct.
Out, which is the boom boom we hear. The second boom. That's the one that pumps the blood out.
That's correct.
But that chamber needs to refill up.
That's true.
So it can fail in pushing the blood out, which we say the left-sided heart failure. Is that right?
So when the left side of the heart can't pump blood forward, the pressure is felt by the lungs. So the lungs become stiff. Sometimes there's fluid on the lungs, and then the right side of the heart feels that pressure too. So the heart, in the old days, we would believe that there's a left side to the heart and a right side. Now we think of the heart as one single structure. So anything happening on the left is felt on the right, and the right side of the heart, if it can't fill properly, that affects the left side of the heart too.
That's right. Yeah, they need to work as a unit.
That's correct.
Now, looking at the causes of for that pump to fail, from your experience, what would you iterate as the real causes for the pump to fail?
The main cause remains a heart attack. The heart attacks remain the biggest cause of these problems. In the developed world, it is closely followed by people that have had hypertension for a long time, high blood pressure, or people that have had diabetes. In the developing parts of the world, it might be because of valvular disease, rheumatic heart disease causing problems.
Yes.
Alcohol is also a big one. Viral infections affecting the heart. Treatments for cancer can cause heart failure. And there's a list that's about 30 or 40 deep. But the further away we go from the main causes, they are very rare.
They become rare indeed, yeah. So yes, you said coronary artery disease, which is, a heart attack remains the #1 cause of heart failure. Because when somebody has heart attack, we're talking about the muscle dying off.
That's correct.
And then the muscle dying off, therefore the heart obviously as a structure becomes defective in terms of pumping the blood. That's right. Now looking at, you said blood pressure is the second risk factor?
Yes, yeah.
And how does one know that actually you've got blood pressure issues? Because blood pressure, most times it's a silent disease.
It's known as the silent killer.
Silent killer.
So the person that can help with this is your GP, regular visits to the GP and getting your blood pressure checked or getting your blood pressure checked in the community.
In the community, and the pharmacists now can do that. Just check the blood pressure. It is very important that we keep the numbers in the check. But we can also prevent blood pressure, or we can monitor blood pressure, or we can control blood pressure by changing your lifestyle.
Absolutely.
Maybe if you're overweight, you need to work on your weight. If you use lots of salt in your food, again, you need to cut down salt.
That's right.
Because you build up fluid in the water and, in your body, and that will put up the blood pressure. And keeping active in those things, lifestyle.
So everyone should, whether they have heart failure or not. So exercising, keeping the weight down, eating less salt, keeping your blood pressure low, controlling diabetes, all of these help to prevent heart failure. Not just treat it, but by looking after these, you can prevent the onset of heart failure too.
That's right, that's right. So in your experience, at what age do you normally see people having trouble with heart failure?
So mostly we start screening people around the age of 40 for cardiovascular risk factors. If they have had family history or they come from high risk situations where there is valve disease, so you can start screening sooner. But around the time people are 40, we usually start monitoring them for their diabetes, cholesterol, and other risk factors for heart problems.
Yes, and you're talking about valve disease in particular. What are you talking about those ones?
So, in the Western world, aortic stenosis is a very common cause for heart failure. But in the developing world, where rheumatic heart disease is still common, you could get mitral valve disease or tricuspid valve disease or mixed valve disease. That is a very important cause for heart failure.
Heart failure, that's right. Okay, and okay, the prevalence and incidence of heart failure gets worse as you get older.
That's correct.
And when you're 70 plus and stuff, you got all these comorbidities and you got heart failure on board because it's dramatic instead. Now, how do you approach it? Let's say somebody's got a newly diagnosed heart failure, or rather, should I pull you back and say, what are the symptoms people should watch for?
So the main symptom is shortness of breath. And if you were able to walk 500 meters 6 months ago, and now you can only walk 200 meters or 250 meters, that is where you should start thinking of that. Now, of course, it's very hard to separate from lung problems. You could be short of breath from heart issues, you could be short of breath from lung issues, or a combination. So that's always important to get it right. And then you apply tests in a graded manner. Obviously, everyone should get an ECG first. We know then that they've not had a heart attack. And then depending on what the ECG shows, you might move on with a chest X-ray, blood test like a brain natriuretic peptide, and then more cardiac investigations like an echocardiography. Sometimes you might want a CT scan or an MRI.
Sometimes. So on echocardiography, what are you looking at?
So on echocardiography, we can look at the left side of the heart and measure the what we call the ejection fraction. So the ejection fraction is a measure of the efficiency of the left side of the heart. It measures the ratio of blood coming in versus the blood being pumped out. So anything between 55 to 75% is considered normal. Below 50% we start worrying about heart failure.
Yes, yes, and then you start to put some preventive measures in place.
Yes, yeah.
And I mean, the various guidelines anyway in terms of heart management, but overall, across the world, the concepts are the same. Yeah. How would you approach yourself as a cardiologist? Yeah.
So lifestyle advice is the first thing we always tell everyone. Everyone should do that, particularly those that have risk factors. So exercise, control your weight. If you have diabetes, control your diabetes well. If you have renal problems, they should be looked after. Salt and water intake should be optimized. So this everyone should do.
Everybody should do.
The next step you do is add medication. And the most important medication one can have is diuretics. These are the tablets that make you lose fluid.
Yes.
So these are the cornerstone of all heart failure treatment.
Right.
So you start off with diuretics, and then comes what we call ACE inhibitors or angiotensin receptor blockers. So these are blood pressure tablets essentially.
Yes.
Now you might say that, look, I don't have blood pressure, why are you giving me blood pressure tablets?
That's right.
But the lower the blood pressure, the more the heart becomes efficient. So to a point where you don't get dizzy and the blood pressure is not too low, we encourage the blood pressure to drop as much as the patient can tolerate.
Yes, yes.
So that takes the load of the heart and increase its efficiency.
Yeah. So we got the diuretics there because we are reducing the fluid. In other words, we are reducing the workload of the heart. That's right. And then, of course, patients they got to take in the morning. I'm sure most of the patients who are taking they know that you have to take in the morning because they will be peeing all day. You don't want to take. That's right. So you were reducing the workload. In other words, we're reducing the heart's effort to pump the fluid out. And then you said ACE inhibitors, again, to lower the blood pressure, but indirectly also to preserve the heart. And anything else you have to add on this?
We move on to what we call mineralocorticoid agents like spironolactone. These act by reducing the harmful things like adrenaline and noradrenaline in the blood together with the ACE inhibitors. Once we get rid of the fluid, then you think of beta blockers. So beta blockers slow the heart down and increase its efficiency. So we know from athletes that the fitter people are, the slower their heart rates are, and we are trying to replicate that to some extent. So by slowing the heart down, you make it more efficient, and ACE inhibitors are taking the pressure off the heart. So they're making the heart work load less.
Yes, yeah. But the problem we see there is, as family physicians, when you put these patients on these multiple medications, especially for the younger population, I mean, they come, let's say, they got sexual issues, for instance, if you put them on beta blockers, because that's one of the side effects. How can we counter around that? Because the patient will rightly say, no, it's affecting my sexuality. I'm going to stop the beta blocker if it is the culprit.
So reducing the dose often helps. So reducing the dose of the beta blocker and optimizing other medication often helps. But conversely, getting the heart rate, getting the heart function back might help them with their problems too. So in the short term, getting the medication right is important. Once the medication is optimized, the sense of well-being improves and other problems might also settle down.
Yes. Okay. All right, and other side effects like swelling of the legs, again, people complain about.
Swelling of the legs, cramps, all of this can be helped by paying attention to the electrolytes. So if by over-diuresing people, if we give too much furosemide, for example, they might get cramps. So replacing the potassium in the blood, that helps. So if they develop a cough from the ACE inhibitors, shifting to angiotensin receptor blockers might help too.
The alternatives, that's fine. That's okay. Let's say you've optimized, okay, you've done all the medical management, and okay, my breathing is still getting worse. I used to walk 200 meters, now I can't even walk my dog 100 meters. And I'm taking all my medication. I'm very compliant. I'm keeping up as much as I can. Yeah. What else can we do
yes,
for this
that's an
patient?
important question. So somebody that has settled down on treatment, if they start getting worse, then you need to look at quite a few things. Most importantly, make sure the patient is taking their medication.
Yes, yes.
So taking medication is important, and if the medication is correct, are they sticking to their fluid intake, fluid and salt intake?
Yes.
Thirdly, if there are any other illnesses going on. So somebody with heart failure might develop the flu and the heart failure might worsen, or they might have the pneumonia and develop an increasing in problems. Other issues to look at are whether they are developing new coronary artery disease, rhythm issues like atrial fibrillation are important, and worsening valve problems.
Yes,
so these are some common causes for heart failure that gets worse.
And also this condition, cardiomyopathy, is deemed as one of the risk factors for heart failure as well. Right. But that one is notorious to treat. Is there a treatment for cardiomyopathy?
There are some treatable cardiomyopathies. Ischemic cardiomyopathy you might make better by treating the ischemia. There are some cardiomyopathies that settle down by themselves with medication, and there are some familial cardiomyopathies or hereditary cardiomyopathies that you cannot make better. So staying on top of them with medication is important. And there are some special new tablets that we have now. They are called the ARNIs. ARNIS. So they help with the management too. Now if all of this fails, you have to go to the next step.
Yes.
There are some electrical devices, special pacemakers that help get the rhythm of the heart right. So that's the next step.
Right. So how does that help with the function? If you get the rhythm right, how does that work with the function of the heart?
So if the heart can't work in tandem, if the upper and lower chambers of the heart can't work together, or the left and right side of the heart can't work together, you can put pacemaker wires into the heart, and then the pacemaker will time the heart perfectly.
Right.
So then the right and left chambers or the upper and lower chambers are working together.
Yes, yes, yes. So that's fine.
And people with heart failure can develop arrhythmias. So if the heart is weak, there is a high risk of getting dangerous arrhythmias. So sometimes you need to put special devices in to give the heart a shock from the inside. Right. So they are called implantable cardioverter defibrillators.
Yes, yes, yeah. That's down the track.
That's correct.
Down the track. Yes. That's because it is scary. Yes. Right. For those who are still sexually active, they'll say, okay, now is there precautions I have to take when I've got my heart which is a bit defective? Any precautions regarding activities, including sexuality, swimming?
Exercise of any sort is not a contraindication. Everyone should exercise. The fitter you are at any level of heart failure or heart problems, the better your outcomes are. So physical exertion itself is not a contraindication at all.
So that shouldn't limit their sexuality?
No, should not limit it at all.
That's right. Okay, that's good. Any new things coming up on the horizon in terms of research?
So the cardiac transplants have been around forever, but cardiac transplants are now not done as commonly as they used to be. The medical treatment for heart failure is now very effective, and the need for cardiac transplants has gone down a fair bit. There are special devices that can be used to see if the heart recovers. They are called assist devices. So all of this happens in special units in Queensland where we all work. There's one of them in Brisbane. So people get down there. It's like an artificial heart that works for the patient until they get better or they get a transplant. So it's called a bridge to a transplant.
So you have to stay there?
You have to stay in the hospital.
And how long is it? Quite indefinite?
As long as you get your artificial heart, you get your cardiac transplant.
And how do they choose the right candidate for that?
So a right candidate for a transplant is somebody that is reasonably young. They will be on somebody that can take their tablets, somebody that understands their condition well and is able to look after themselves well.
Yes, yes.
Of course, if you have multiple organ involvement very earlier on, transplants are quite difficult. So they are reserved for people that don't have a lot of systemic issues and are able to look after themselves very well.
That's good. No, we appreciate your vast knowledge of cardiology and in particular the heart failure concept. I don't have any questions for you, but I just want to thank you for coming to the show and giving us this opportunity. I'm sure the viewers out there, like I said, this show is available to anybody, to everybody.
Yes.
It's online, it's international, and on the show we subtitle everything to English and as well as Spanish. So, and we're getting good responses and people are learning, and the purpose of the show is education, awareness, and maybe just encouraging health professionals to interlink and pose discussions. Basically.
And people can always go back to their own doctors and discuss their specific problems.
That's right. Yeah, that's right. We're just building up to what other health professionals are doing. We're not contradicting anybody. Yeah. So we just here said, okay, you got this issue, whatever, or you're not taking your medication. Maybe you need to take your medication.
Absolutely.
You need to work with your doctor, your local health professionals. They know you better. So this forum is just for education and stimulating debate. That's what it is. So we thank you for joining us again on the show. And
thank you for having me.
Dr. Yadav, we appreciate your coming. Everybody else, keep well, keep safe, and God bless you. Bye-bye for now.